What are the combined health risks of having both obesity and hypertension, sir?
Combined health risk is very, very high. It is threefold higher. That means a person is obese, he has got health risks for cardiovascular disease. But if he has got also hypertension, it will be 3 times more than having obesity alone. So it is very, very detrimental. One thing is that obesity increases hypertension, and when they are together, they are really very dangerous for cardiovascular health.
Can losing weight help in reducing blood pressure? If yes, how significant is this impact?
Obesity increases hypertension. So when you lose it, it also decreases hypertension. It decreases blood pressure.
What lifestyle changes or precautions should an individual can take with obesity to prevent or manage high blood pressure?
Sleep has got a huge role in our lifestyle, and lack of sleep or sleep at the wrong time increases both obesity and hypertension and many more cardiovascular diseases. So we should have proper sleep in the right time and for the proper duration.
How often one should monitor their blood pressure, and what is the correct way to measure it accurately?
Measure blood pressure correctly, that is very, very important. I think people should prepare themselves for blood pressure monitoring. For the last 30 minutes, they should not smoke. Having caffeine, I think coffee and tea they should not take, and they should not exercise for the last 30 minutes. And while taking blood pressure, they should sit upright on a chair, and at least for 5 minutes, they should take complete rest.
Hello and welcome to Heart Talks, where we will bring some insightful conversation on hypertension. I'm your host, Archana, and we are joined by Dr. Bikash Bhattacharjee. Today, we will be talking about hypertension, its risk, monitoring, treatment, prevention, and management. And our topic of discussion is managing obesity and hypertension for better heart health. So let's get started with the first question. What is obesity in simple terms? And how does one know if they fall in this obese category?
Obesity in simple terms means excess or abnormal fat in our body, which is harmful to our normal health. It can be identified by measures of BMI, which is our body weight in relation to our height. And for different people, there are different measures of this obesity. For Western people, if the BMI is more than 30, it is known as obesity. For Indian population, if the BMI is more than 25, it is called obesity. But it is only BMI is not enough to identify obesity. If there is fat in the abnormal places like abdomen and in the organs like kidney, heart, liver, it is also obesity. And this can be measured in a different way, in a simple way, by taking the waist circumference. For waist circumference for Indian males, it is 90 centimeter, and whereas for women, it is 80 centimeter. So these are the very simple way we can know whether we are obese or not.
My next question to you is, what are the common causes of obesity and how much do lifestyle and genetics contribute to it?
There are many causes of obesity, but the most important causes are actually excess calorie intake, that is excess food intake, having high calorie, and lack of physical activity. It is very simple thing. We are taking more energy, but giving out less energy. So very simple way, we accumulate fat in our body. And the most important thing is that environment influences obesity in a very big way. But genes have also got very important role to play. If the parents are obese, there is every possibility that their children will be obese. So that is very, very important. And also there is another thing called epigenetic changes that happens during our lifetimes. So one is we inherit gene from our parent, and one thing we change our gene during our lifetime by bad lifestyle. So most important thing is lifestyle and gene interaction. But if we can follow good lifestyle, we can avoid also obesity.
So doctor, my next question to you is, What are the health complications associated with obesity? Does obesity increase the risk of high blood pressure? And how are these two connected?
Obesity is the mother of many diseases. In fact, there are more than 200 complications from obesity, and they are mostly metabolic, mental, or mechanical. Metabolic complications are very common. Type 2 diabetes is very, very common in obese population. There is dyslipidemia, high cholesterol level. They're very, very common in people with obesity. And there are a lot of mechanical complications, like, incontinence of urine. Many people cannot, they feel urgency. They have to pass urine very frequently. And sleep apnea is another condition. Snoring and all. These are very, very common mechanical complications. And there are mental complications also. Many people with obesity suffer from depression and anxiety. So there are many, many complications of obesity. It is a very important cause of cardiovascular diseases. It is a very important cause of liver diseases. So, these endless complications are there. When talking about hypertension is one of the complication of one of the risk factor of obesity is one of the risk factor of hypertension. Many of the people with obesity has got hypertension. The reason being many, but one of the very important reason is that obese people have got insulin resistance. There is some hormone in our body. It cannot work properly. When it works properly, it makes nitric oxide and that dilates the blood vessels. And there is lowering of blood pressure, relaxation of the blood pressure. That doesn't happen in obese person. Also in the obese person, kidney keeps in more sodium, that is salt. And so there is high blood pressure. And also there is activation of sympathetic nervous system that also increases heart rate and cardiac output. That also increases hypertension. So hypertension is very common in people with obesity.
This is quite serious. Thank you so much, sir. This information will surely help our patients. My next question to you is, how does high blood pressure affect the heart? And why is it considered a major risk factor for cardiovascular diseases?
Hypertension affects the heart very badly. It is the most important risk factor for most of the cardiovascular disease, including stroke, myocardial infarction, heart failure. Because hypertension changes the structure and function of the heart, and also it damages blood vessel. So it causes huge harm to the cardiovascular system. And prevention of hypertension or control of hypertension is paramount importance for prevention or management of cardiovascular disease.
Thank you for explaining this in very simple language. Moving ahead with our next question. What are the combined health risks of having both obesity and hypertension, sir?
Combined health risk is very, very high. It is threefold higher. That means a person is obese, he has got health risk for cardiovascular disease. But if he has got also hypertension, it will be 3 times more than having obesity alone. So it is very, very detrimental. One thing is that obesity increases hypertension, and when they are together, they are really very dangerous for cardiovascular health.
Understood, doctor. Thank you. My next question to you is, can losing weight help in reducing blood pressure? If yes, how significant is this impact?
Very important thing. I think because obesity increases hypertension. So when you lose it, it also decreases hypertension. It decreases blood pressure. It is possible with bariatric surgery. It is also possible with drugs. It is very much possible with lifestyle modification. When people loses weight, 5%, 10%, they definitely blood pressure goes down in a very significant way. It goes down. And so, for people with obesity, the first thing that, along with medication, the first thing should happen that we should lose weight. And it is very, very important.
Moving ahead with our next question. Sir, what lifestyle changes or precautions should an individual can take with obesity to prevent or manage high blood pressure?
I think this is the most important question, because these diseases, obesity and hypertension, is to a great extent lifestyle disease. So if we modify our lifestyle for betterment, we definitely can modify the disease. And lifestyle modification mainly, first thing is diet. We should have the correct diet, lot of vegetable fruits. We should avoid fast food, and we should take help of a dietitian or nutritionist. That is very, very important because they are professional people. They know which is good for whom. And then physical activity is very, very important. But then before starting physical activity, those who are very obese or having other complications for a long time, they should seek a cardiological opinion so that what sort of exercise will be safe for them. That is very, very important. And one more thing is very, very important is sleep. Sleep has got a huge role in our lifestyle, and lack of sleep or sleep at the wrong time increases both obesity and hypertension and many more cardiovascular diseases. So we should have proper sleep in the right time and for the proper duration. So these are the lifestyle modification one can take and one should continue for a long time. And drug will definitely help, but without lifestyle modification, they are not very useful. So it's very, very important for all people. All people who are healthy, they show that they remain healthy, and who have become unhealthy to become healthy, lifestyle modification is very, very important.
So my next question to you, doctor, is does obesity medication impact blood pressure and overall cardiovascular diseases?
Absolutely. And the newer medication, those have come known as GLP-1 receptor agonist. I think people know about it. Ozempic, then double agonist, Monjaro. These have become a blockbuster thing, and everyone knows almost like film stars in these days. And they can bring down weight to a great extent. About 15%, 20%, what was only possible with bariatric surgery. So they can bring down weight, obesity to a great extent. Not only that, not only weight, they can reduce the waist circumference also. And so they bring down blood pressure to a very significant extent. And they are really good for cardiovascular health. They reduce the incidence of myocardial infarction, stroke, and cardiovascular mortality. So these are great molecules and they really help us. And it is really a revolutionary molecules have come. And whenever necessary, we can use it for the people who need it. With, of course, precautions, we will do it. And one must take doctor's advice before taking those things. Otherwise, there may be big problem.
So, doctor, as you said about bariatric surgery, so does it produce clinically meaningful reduction in both blood pressure and both body weight?
Of course, very clinically meaningful. First thing is, what is clinically meaningful? Body weight reduction, more than 5%. And these are not 5%. Those are the newer ones, as I said, GLP-1 receptor agonist or tirzepatide, they reduce to the extent of 15%, 16%, 18%, 20%, more than 20%, 22%. So these are very, very meaningful. And also they reduce very significant way systolic and diastolic blood pressure. So it is very, very meaningful reduction of weight and blood pressure by this medication.
So, doctor, my next question to you is how often one should monitor their blood pressure and what is the correct way to measure it accurately?
This is very important. I think nowadays in our home, we have a lot of things we keep at our home. But two things should be there. One is a home blood pressure monitoring device and a weighing machine. And time to time, we should weigh ourselves, our weight, and also see our blood pressure. Now, those who are normal, at least once in a week or at least once in a month, they should see their blood pressure. Because today it is normal, it may not remain normal. So that is important. And those who have got blood pressure, it will be dictated by their concerning physicians. And nowadays they can see every day. Home blood pressure monitoring has become so easy. And it is very easy to use it. So it depends on how frequent it is necessary, and it will be dictated by their physician. But then when there is a change of medication, then it should be seen very frequently. And I think it is easy to see once in a day. Sometimes it is possible to see twice in a day because blood pressure varies from morning and evening. So it will be told by their doctor. So this frequency depends on the necessity. And how to measure blood pressure correctly, that is very, very important. I think people should prepare themselves for blood pressure monitoring. For the last 30 minutes, they should not smoke. They should not take any caffeine, having caffeine. I think coffee and tea they should not take. And they should not exercise for the last 30 minutes. And while taking blood pressure, they should sit upright on a chair. And at least for 5 minutes, they should take complete rest. Someone coming running from somewhere, they should not take blood pressure. You should take rest for 5 minutes, and then blood pressure should be taken. Cuff should be used, the appropriate cuff should be used in the upper arm. And in some monitoring system, it takes from the wrist or finger. That is not good. Cuff should be there in the arm, and it should be in the level of the heart. And in the proper way, in a very serene way, the blood pressure should be taken.
So, doctor, my next question to you is how often one should monitor the blood pressure and what is the correct way to measure it?
Very important question. And I think nowadays we keep a lot of things at our home, but few things should be there. One is a weighing machine, one is a blood pressure instrument, home blood pressure instrument, one thermometer, and if there is anyone having diabetes, should be a glucometer. These things are very, very essential these days. So as far as blood pressure is concerned, if a person is normal, he should see, if not once in a week, at least once in a month. But the person who doesn't have a blood pressure, he may have blood pressure. He may develop blood pressure. So monitoring should be there for healthy people also. Those are having blood pressure, they can do it daily, very easily with home blood pressure monitoring device. In the morning, in the evening, because blood pressure changes. What is in the morning, it may not be in the evening. And they'll be guided by their physicians how frequently they should see. And it becomes very frequent when there is change of medication. It should be seen frequently. And that is the way, blood pressure monitoring should be done. But it should be done very correctly. Haphazardly, it should not be seen. So when one thinks that he will have blood pressure, he should prepare himself or herself. They should not have exercise for the last half an hour. In the last half an hour, they should not take coffee or tea. They should not smoke. They should take rest at least for 5 minutes on an upright chair. And the cuff should be upper arm cuff. A lot of blood pressure instrument they take from wrist or finger. That is not correct. It should be upper arm and the proper size of the cuff. And the hand should be in the level of the heart. And he should take rest completely. Feet should be flat on the floor. And that way blood pressure should be taken, and that will be accurate blood pressure.
Thank you so much, doctor. So my next question is, many people consume caffeine for weight loss. Can excessive caffeine intake lead to sudden spikes in blood pressure?
Yes, I have told about that. And too much of caffeine reduce weight. These are controversial thing. I think it may not be so correct. But then the studies are there. 2 cups of coffee a day could be good for our heart. But that's all right. But then when talking about blood pressure, caffeine increases blood pressure in an acute way. When you take it just after that, after 30 minutes or 120 minutes, it remains elevated. So caffeine should not be taken at least prior 30 minutes before taking blood pressure. And that should be very much important thing. That one precaution one should take before taking blood pressure.
My next question to you is, there are common myths about heart health. For example, medications can be stopped once blood pressure is controlled. What is your advice on this?
Myths these are dangerous things. Blood pressure medication should not be stopped. Many people think it is normal. They must understand that because they are taking blood pressure medication, that's why it is normal. Once they stop it, it will go high. And it is really dangerous. And that's the way many people precipitate stroke and heart attack. So that should not be stopped. If only doctor thinks in that way, in his own opinion, he thinks that way, only then you can stop. Otherwise, never. One should not stop medication.
So we should not believe the myths.
Absolutely.
Thank you, sir. So, doctor, my next question to you is sometimes a single high blood pressure reading can cause panic. So, how should one individual interpret such readings, and when should they seek medical help?
Very, very important question. And we got a lot of phone calls like that. People go running to a chamber and someone takes blood pressure and it is high and he become very afraid and then they call us. I think that is the wrong way. That's the thing is that one should prepare for blood pressure monitoring. It should not happen like this. He should take rest for some time, as I've said, and then in the proper way, blood pressure should be taken with the proper instrument also. So that is very, very important. And if it so happens, the advice will be that blood pressure should be repeated. At least blood pressure should be taken twice, if not thrice, and the mean blood pressure should be taken. And in this case, he should take rest proper. He got to the proper man person, whoever who knows blood pressure monitoring, and the blood pressure should be taken in a proper way, and it has to be repeated. And then one should act upon that blood pressure, not suddenly a random blood pressure.
My next question to you is beyond diet and exercise, how important are the factors like stress, sleep, and mental well being in managing blood pressure and overall heart health?
Very, very important thing. Those are very, very important, especially sleep. Sleep disturbance is a big cause of heart disease, obesity, diabetes. One should have proper sleep of proper duration in proper time. Not that someone will work throughout the night and sleep at daytime. This is not the thing. He should sleep at the right time. So sleep is very, very important. Sleep health nowadays we ask for sleep health. If the sleep health is not correct, it has to be, and this is the very important part of the lifestyle. Stress is another factor, very, very important factor these days. And I forgot to tell one thing. Sleep actually changes hormone. One hormone is the leptin. It is very, very good hormone, satiety hormone. It decreases when sleep is disturbed. And another hormone that increases appetite or desire to eat, that is ghrelin, and that is increased by disturbed sleep. So that is very, very important. And stress is another very important factor. Our life is very stressful, but we should learn how to remain at least reducing stress. Stress increases another hormone, cortisol, and that also causes a lot of problems. I think we talked about stress and sleep and mental well-being. Now, what is health definition? Health definition is mental and physical well-being. So there should be mental well-being. He should be his mind should be at peace at least. It should be, if it is very worried, he is depressed, he cannot have a good health. Now, yoga and this thing, meditation is good. They really help in mental health. So one can take help of this, and I think is a good thing. People who are doing yoga and meditation, and in many ways, music is a very good thing. Reading a good book is a very good thing. That gives us relaxation and all. These are very, very important.
Thank you so much, doctor. So that brings us to the end of this episode on hypertension, its risk monitoring, prevention, treatment, and management with Dr. Bikash Bhattacharjee. Thank you, doctor, for sharing such valuable insights on managing hypertension and obesity. I'm sure our listeners found this discussion very helpful and practical. Stay informed, stay healthy, and we will catch you next time.